For over 6 decades, Valley Children's Hospital has served the 1.3 million children living in the Central Valley. With many in this population medically underserved, our 330-bed main hospital campus in Central California is uniquely positioned to address the needs of children and their families so that they can have a better and healthy future. Since 1999, Valley Children's has been training pharmacists to provide specialized care to the pediatric patients of the Central Valley. This is an ASHP, or American Society of Health System Pharmacists, accredited PGY1 pharmacy residency program, and it has an emphasis in our pediatric population. We recognize that pharmacy schools do not provide sufficient training for pharmacy students to become a successful pediatric pharmacist. So this residency program will focus training to treat the pediatric disease states. We will do this training through a hands-on approach throughout the clinical rotations, and also residents will receive didactic core lectures on pediatric disease states throughout the year that are given by our pharmacists.
Pharmacy residents at Valley Children's are exposed to a wide variety of experiences, from critical care to acute care to ambulatory, medication safety, administration, and many, many electives. Our graduates are some of the most sought-after pharmacists in the United States. Children's hospitals look for residents from Valley Children's program because they know the caliber of our graduates and the pharmacists that they will be and what they have to offer to any children's hospital pharmacy program in the United States.
As a 24-hour pharmacy within the Valley Children's Hospital, we have to serve both the operational and clinical needs of our kids each and every day. We do this by integration of technology within our processes. These integrated technologies not only help us provide the best and safest care for our patients, but it also helps us keep our staff safe from injuries and mistakes. As an example, we have the Reaver machine within our IV rooms. This is a technology that makes IV medications without any human touch. We put our residents to work each and every day by integrating them directly into our staff. We expect them to work at the top of their scope of practice, which means they're functioning as a full pharmacist. We expect that not only of our pharmacists, but also of our technicians. We want them to be happy with the work they do, but also produce the top quality work that we expect of them.
From the moment I started interning at Valley Children's, I knew I wanted to be a resident here. I was instantly attracted to the warm atmosphere and the staff, as well as every employee's strive to always give their best. I realized that pediatrics was a perfect fit for me because I really want to help other people, and I believed that there's no better population to help than those that are the most vulnerable.
When I woke up during match day at 5 a.m. and saw that I matched with Valley Children's, it was a great feeling. Growing up in the Central Valley, I knew that I wanted to give back to my own community. Completing a residency at Valley Children's means that we're taking care of the sickest kids in between San Francisco and LA as the only standalone pediatric hospital here. After completing a few rotations at Valley Children's, I noticed the great rapport the pharmacists had with the physicians, with the residents, the nurses, and I knew that this was a team that I wanted to be a part of.
Before applying to residency, I remember looking at the Valley Children's Hospital website and being amazed at all the opportunities they had to offer. From the wide variety of required rotations and elective rotations, opportunities for both inpatient and ambulatory care rotations, opportunities for teaching, and opportunities for presenting. At ASHP midyear, I got the opportunity to meet with the current Valley Children's residents as well as the program director. I remember being greeted by the pharmacy residents who all shared a similar enthusiasm about their work at Valley Children's. In all my interactions with the Valley Children's staff, I could tell how much they loved the organization, the mission, and the kids that they served. I knew that this was a team that I definitely wanted to be a part of, and that Valley Children's was a place that I could see myself growing as a pediatric pharmacist.
I've really enjoyed interdisciplinary rounds in the PICU. They take such a family-centered approach to care that equally relies on input from nursing, pharmacy, respiratory therapy, and PT. The role of pharmacy in the PICU is huge. They really rely on us a lot to help aid in the management of these kiddos. With our many protocols such as heparin, enoxaparin, aminoglycosides, vancomycin, and electrolytes. Another unique experience we get in the PICU is trying to find alternatives to traditional therapy and literature. A perfect example of this that happened recently was we had to try and find a way to concentrate a kiddo's antibiotics to try and find a way to reduce the overall volume he was receiving over a 24-hour period.
One of the many things I love about Valley Children's is the opportunity for growth. Back in 2007, I arrived here at the hospital for a job shadow with a clinical pharmacist, and I never left. Since then, from intern to resident, I have been trained in numerous areas, from oncology to intensive care to infectious disease and much more. After establishing my clinical foundation, I took the lead NICU pharmacist position after only 3 years out of residency. My pharmacy leadership was always there to support and empower me every step of the way. And after 13 years with Valley Children's, I can say that I continue to learn and grow every single day.
It has always been a goal for Valley Children's Pharmacy Department to expand their clinical services, whether that's going to be our antibiotic pharmacy to dose protocols or any anticoagulants. It will also be expected of the residents to answer any medication information questions, whether that's from medical residents or the attendings. Future residents can expect to be a part of family-centered rounds during their internal medicine rotation and possibly the oncology rotation as well. During your NICU rotation, you'll be expected to do multiple topic discussions a week, and that's just simply because neonates have a few different disease states compared to normal pediatric patients. You'll also be doing some bedside or table rounding as well, and then just the most important thing is making sure you understand what it means to be a NICU pharmacist. It's very important for the NICU pharmacist to make sure we are having the appropriate dosing, we're monitoring the patient appropriately, and have that duration of therapy set. And then another important part of the job is to make sure that our patients get their vaccines before they're discharged.
As residents, we spend most of our time in the hospital, so it's really important to us that the food's pretty good. And our Grape Jellyfish Cafe, which is our cafeteria, has some really great dining options. We've got salads, sandwiches, pizzas, and then our daily grill specials. So surprisingly delicious food. We do have a Starbucks located on campus, and on Fridays we have our farmers market, which also hosts a variety of food trucks. Fresno's uniquely located in the heart of the Central Valley, which is right in the middle of California. So whether you're wanting to go to the mountains to ski or head down to the beach to relax, or even drive down to Disneyland and enjoy some of the rides down there, you're never really more than a couple of hours away from a quick vacation. I chose Valley Children's because from the moment I walk through the doors, it's very clear exactly how important the children and the families are to every staff member.